The first module we'll be talking about is the Early Start Denver model. ESDM is considered the one and only and most cutting-edge effective treatment of autism. We start early with ESDM as early as 12 months of age, and some therapies we even start earlier than that. So there are some, such as early intervention specialists that come into the home as well, and we'll start with some of the ESDM methodology. Basically what it does is it repairs the defective connections in the brain. So we see on an MRI of a child's brain that certain areas, if they are affected by autism, are not as developed as other areas. So what ESDM does is uses the developmentally appropriate sequence to change the brain in the appropriate sequence that it should have happened during development. And this is the biggest difference from ABA. ABA, or Applied Behavioral Analysis, is a treatment methodology where they identify what the behaviors are and focus more on the behaviors, whereas ESDM repairs the damage and rewires the brain. The reason that it works is because you're connecting with the child, and then you're working on their imitation skills first. And the reason for that being they have to be able to focus and attend and imitate in order to learn. And you're using motivation. So whatever it is that motivates the child initially to get them encouraged to interact, we use. And so if a child's being motivated, they learn better. It's developmentally based, so it goes from the earliest developing skills to the later developing skills and fills in any gaps. And so it allows the brain to develop the way that it would normally develop. It also provides specific activities that need to be completed in order for the brain to develop the right way. So we know exactly what skills have to be practiced, which makes it really easy for families. So we can move right to the next step. So first it's putting 2 shapes in a shape sorter, then it's 4 shapes in a shape sorter, then we move on from that and we're doing a different activity. So it makes it very organized. The parent involvement is critical, so we can set the program, but you are the one and the only one that can implement the program. And that's why this training is so important. We have a part of the training, the 3-week intensive, where you're basically are going to be your child's therapist and help them through some of the challenging parts of the program with our help, of course. But the parents are critical, and in fact, the parents are running the show when it comes to ESDM. They're deciding the goals with help, and then you're making sure that they're being carried through at home, and then we are also giving the goals to all the other therapists and people in the child's life. We are also, with ESDM, you're doing the strategies that can be used in the natural setting. So we're not making it so difficult that you can't just, while you're cleaning up from something, work on their ESDM goals. Consistency is the other part of ESDM that is really critical. So the reason for the focus time each day is because you need to work with your child over and over again in order to build the stamina for play, the stamina for interaction, and then the skill set by repetition. It is all based on play, so that makes it a lot more appealing to the kiddos. And so at this age, a child's play is the most important work they can do. And so there's different types of play and different levels of play that they attain as they get older. So we want to start with the very basic developmental play, and then we work up to things that are more imaginative play and then interactive play. It's also based upon positive reinforcement. So when we see them doing something that we love, we want to reinforce them by a big smile or a high five or a yay. And also the other part of positive reinforcement is natural reinforcement. So when they ask for something using their words and their eye contact and they get it, that's in reinforcement. So that is another thing that we do very naturally with the ESDM program, and it encourages the children to crave positive reinforcement, whereas in the past they may not have even been interested. We also, as far as when we're working with ESDM, we're focusing on preemptive behavior management, which means we're catching the behavior before it happens and before it gets too upsetting. So we're careful with the things like transitions, like taking turns, to slowly introduce them. And when we know that a child is getting bored, we're moving on to the next activity rather quickly. So those are just some examples. And then there's different levels of the ESDM program, and we use different levels within the School of Imagination inclusion setting. But it can be something that's a very direct, everyday pull the child aside and work with them, or it can be something that they've reached this level of just making sure that they're staying on top of their goals throughout the day. So if your child is, once your child has the understanding of the skills and has reached a level where they can be carried over, you can then share the goals, the new goals, with your classroom teacher, and they usually are pretty successful at implementing them at school as well.
Yeah.